Good afternoon, brothers and sisters, and we'd like to welcome you to the session we're going to do today. We have got a doctor who's going to speak to us on diabetes, which is a big problem in society today. Type 2 diabetes is extremely common globally, and we have got a doctor that's going to speak to us about it. As I've mentioned, she will be covering the causes of diabetes, how it can be prevented, type 2, the treatment, how it can be reversed, and then she's also going to cover the complications on type 2 diabetes. So we would like to welcome Dr. Matanda. Thank you so much for being so willing to share your knowledge with us yet again. And before we dive into it, can you please open for us in a word of prayer? Thank you.
Okay, let us pray. Dear Father in heaven, we want to thank you for your love and guidance and provisions that have brought us this far. Forgive us for all the sins we've committed against thee, where we have lacked trust in thee, where we have sinned against your direct laws that you've given us. We pray that you forgive us, Father. And we pray that you might be with us throughout this presentation. Help me, Lord, to have clear language, clear voice that's understandable. Please be with the listeners and those who are watching so that they might also understand what I'm trying to put across. After all is said and done, Lord, we seek for your blessing. In Jesus' name we pray. Amen.
Amen. Amen. So over to you, Dr. Matanda. You can educate us on diabetes. Thank you.
Okay, I would like to greet everyone. Welcome to our program, and thank you very much for tuning in to listen to us as we discuss about diabetes. I know that diabetes is, it's a common disease. It's being spoken of everywhere, and some people are just scared about it. So we're going to try and discuss what is it. But let me just be quick to say that there is a lot about diabetes. I just picked some few germs that we're going to discuss today. There's no way we can discuss diabetes just in an hour and finish. It's a lot. There's a lot of information, a lot of stuff, but I will try to highlight and break it down so that we can understand. Okay, so we are going ahead now talking about diabetes. So how big is the burden of diabetes? We speak about it all the time, but how bad is it? Is it that bad? Where are we? How big is this diabetic burden? The numbers are scary. In 2017, this is the data I have. In America, they spent $327 billion US just for diabetes, no other disease. 327 billion. And 237 billion was in direct medical costs, and the 90 billion in reduced productivity, because once a person has diabetes and they are employed, they're going to lose hours of work, they're going to be admitted, they're going to need to go get medications, see their doctors, they're going to be feeling sick from the diabetes, and their effectiveness in doing work is going to be reduced. So that means that some companies lost 90 billion just because of diabetes, and these are huge, huge figures. In sub-Saharan Africa, where we are, there's not much data because we are not, we are mostly developing countries or intermediate and developing countries. Our data capturing is still a bit behind, and most of our people just remain undiagnosed. So the actual burden remains quite unknown due to lack of data, and a lot of patients remain undiagnosed. And it is estimated that diabetes cases are going to increase by about 58% by 2040. And that's a huge jump in cases of diabetes that's expected. But in Africa, as a general, the most hit countries are South Africa, Nigeria, DRC, and Ethiopia. And they attribute the rise in cases to urbanization. They're saying most of these developing countries, even though they have quite a huge rural population, but there is such urbanization that even those who are staying in the rurals, they are as good as they're staying in the urban as well, because of the lifestyle that they are now adopting, the foods that they're eating, whatever they're drinking is more or less the same now. It's unlike a long back where rural folk had a complete different diet from city folk. Now those who stay in cities and those who stay in the rurals, we are almost approximating each other. And that's why they say there's now a rise in diabetes. It took a long time before diabetes was even described in Africa, but now looks like Africa is really catching up quite quickly. So worldwide, it is estimated that about 5 million people between the ages of 20 to 90 to 79 years, so forgive that N, that's a typo, this N here, just ignore it. From 20 to 79 years old, they died from diabetes in 2015. You see, these are the statistics we have worldwide. Of those that are documented, 5 million people just died, that's like half a country, you know, gone in some countries which are a bit smaller,
I
and that's a death every 6 seconds. You can, just imagine that every 6 seconds someone is dying from a diabetes related issue. And most of these deaths, like I said, they're occurring in the economically productive age group. You see, 20 to 79, that's when people are active. I know most countries have retirement age like at 60 or 65, but people still remain quite active up to around the age of 70, 75. From the age 80 going forward, that's when people really have slowed down. They can't go to work, or they can't really be active. But this is the age group that carries the country forward. This is the age group that carries a family forward, and people are dying this young. Okay, so how do we diagnose diabetes? So let me be quick to say diabetes really is a spectrum of disease that is characterized by a rise in the blood sugar. So there is a certain amount of sugar that's supposed to be in your bloodstream, that if I take some blood and check the levels of sugar, there is acceptable levels. So diabetes is a whole range of spectrum, from the point where you're starting to get difficulties in controlling your sugar to florid diabetes. So we call the first stages, we call it impaired glucose tolerance, that you're not yet really diabetic, but the way you are handling your glucose is not quite there. And then to this other end, where a person now has very poor control of their sugars and their florid diabetes. So for diabetes itself, for me to then just diagnose you to say, okay, now you are a diabetic person, we do in a patient with symptoms. So by symptoms, I mean a person who is having a dry mouth, who is always feeling thirsty, you are drinking more than you should, who is always going to the toilet to pee, and who's always feeling hungry. You eat, you can't get full. You keep eating, you keep drinking, you go and pass a lot of pee, you are always up and down the loo, and up and down from the loo to the tap to drink some water, back to the loo. You can really tell that no, this has become off. So those are some of the symptoms that a person can present with. So in a person with those symptoms, which we call polyuria, polydipsia, polyphagia, polyuria meaning passing a lot of urine, polydipsia meaning the thirst is that's just too much, you can't seem to quench it, and polyphagia meaning you're just eating and you can't really get full. In a person with those symptoms, and we just check a random, we take a sample and send to the lab for a random blood sugar, and it comes back is 11.1 millimoles or more, then we say you have diabetes. Or if you come without eating, fasting, we define fasting as more than 8 to 12 hours without any caloric intake. So someone who has had their supper at around 7 and they've not eaten anything the whole night and the whole day, and maybe I see them in the rooms maybe around 8 in the morning or 10 in the morning, already they fulfill the fasting criteria. So if we check their sugar at that point and it's more or equal to 7 millimoles per liter, then that person is diagnosed as having diabetes. Then there's this other test that we also do. We take blood and send to the lab, which is called the glycated hemoglobin, or HbA1c. If it is equal or more than 6.5%, then someone has diabetes. So in a person with symptoms and any one of these readings, then we can diagnose you that you have what? You have diabetes. You need to start on treatment. In a person without symptoms, say you're just passing by, you're not feeling anything, and it is very possible, let me emphasize this point, it is very possible to be diabetic and have no symptoms at all. Your body can adjust, and you're not feeling any thirsty. You're not, a person can walk in and they tell you, I have a sore throat, and sometimes I have a headache. Can I just get an antibiotic? And then while they're passing by, the nurses, they're doing their observations, they check their blood pressure, they prick them just as routine, and the sugar comes back as like 34 or 30 or 29 or somewhere there. And then you will start asking the person, do you have any symptoms? There is nothing. And the person has been walking around without knowing that they have diabetes. And this is quite common. You can feel perfectly fine and yet you are diabetic. And most of the time, such people will come with complications. We'll discuss about the complications later. So the only time they'll get diagnosed of the diabetes is when they actually have complications. And then that's sad, because that means you have been having your diabetes for quite a long time. You could have gotten help for all this while, and then later on, when one organ or the other has been damaged, that's when you're coming for presentation. So a person without symptoms is more or less the same. The fasting plasma glucose, which is the FPG there, is more equal to 7 millimoles per liter. The oral glucose tolerance test is a test we do. You get your load and you take it of oral glucose, you drink it, and then you fast, and then you drink it first thing, and then we measure your sugar 2 hours post-load. So if we measure your sugar post that load, 2 hours post that load, and still more or equal to 11.1 millimoles, then it means you have diabetes. The HbA1c, the glycated hemoglobin, is still the same figure. If it's equal to or more than 6.5%, then someone is diagnosed of having diabetes. Okay, I'll quickly go through these classifications. Most of them we're not going to discuss today. We'll just zero in on the type 2. So we have type 1, we have type 2, and then we have what we call gestational diabetes, secondary diabetes, genetic diabetes. But the type 1 and type 2 are the more common. Even gestational diabetes as well is also a bit more common. Type 2 is the commonest. That's the one that's more common than any other type. That's the commonest, right? So type 1 is an autoimmune condition. It means that your own immune system is fighting against you. And somehow you are fighting the particular cells that produce insulin. And these cells are called beta cells. They are found in your pancreas. So your pancreas is responsible for secreting a lot of juices and hormones. And among the hormones, it secretes insulin. There's a specific population of cells in the pancreas which secretes the insulin. Insulin is the hormone that helps you control your blood sugar. So if you have this autoimmune condition where your body is destroying your own beta cells, then with time, you are not going to have enough B cells to produce enough insulin for you. Then the sugar starts going up. That's type 1. And it can be related with other autoimmune conditions like your systemic lupus erythematosus, like your rheumatoid arthritis, your ulcerative colitis, all those which are autoimmune conditions. They can be related to type 1, or you might just have only your type 1. And for this type of diabetes, the treatment is only insulin because you lack insulin. Okay. Type 2, I'll come back to it. Gestational diabetes is diabetes that just comes when someone is pregnant and usually clears when the person is no longer pregnant. But there is a chance that it can persist. Starts as gestational diabetes, it then persists throughout life. Or you have gestational diabetes, it clears, but then later on in life, you might still get diabetes, and most likely type 2. Then the other types of diabetes is diabetes that's coming secondary to other diseases. For example, if you're taking a lot of alcohol and you fry up your pancreas, then it means you're not going to be producing enough insulin, and then you're going to have a diabetes. But it's not because you had a primary problem with your pancreas. This is something that comes on as a secondary thing. Then the genetics, we have genetic defects in insulin. There's genes that control insulin secretion and control its production and secretion. And if there's a gene defect in any of those, then you might end up having diabetes. Okay, so let me get back to type 2 diabetes. Type 2 diabetes, initially, it starts as insulin resistance, right? You are producing insulin, but your body simply is not responding to the insulin that you are producing. until it comes to insulin deficiency. So it can be anything from insulin resistance to insulin deficiency or both. So you'll find people who are type 2 diabetes, who have type 2 diabetes, some of them start on orals. They're only on oral tablets and they're taking their fine. And then in the end, the doctor tells them that the oral tablets alone are not enough. I need to add insulin because you've now gone through the whole spectrum. You're at this point where you are also even deficient in what? In insulin. And type 2 diabetes has got many other causes and it is highly influenced by the environment as well. And it is highly associated with what's known as Western cultural habits, which we are going to get into now. And type 2 is really a type that you can do something about it. Okay, so I looked at the complications first before I looked at the risk factors. So I guess maybe we can just go through that the way I've arranged my slides. So type 2 diabetes, what are the complications? You see this like this maze that I put here. Everything just clicks into each other and, it's like diabetes causes a battery of reactions on your whole body. Because diabetes is raised blood sugar more than normal in the blood vessels, and blood is virtually going to reach everywhere. So it means every organ is affected because every organ is going to be exposed to this blood, which has too much sugar than it can handle, than it must handle. It can trigger a lot of pro-inflammatory conditions and lead to a lot of other complications. Okay, so the first complication I'm going to talk about now is blindness. This is quite common. Someone who has diabetes, they've been seeing quite well, and then they start blurring vision, and then they get blind. And when you start getting the eye problems, usually we say our diabetic patients, depending on where they are, every year they must get an eye test, and some we recommend even every 6 months. But here's the thing, the ophthalmologist is really not going to do anything to your eyes if your sugar is not controlled. So they will tell you to get the sugar controlled first before they can try to help you. Because even if they change those lenses or whatever they do, you're still going to harm them from the raised blood sugar. So your sugar has to be controlled. So there's this tiny, small blood vessels that supply our eye. I mean, the eye is a small organ. So the blood vessels that supply the eye are also even quite much more smaller. So they get affected by the raised blood sugars and then they close off. And once that happens, then it means your eye is not going to have enough blood supply, and then your eye is going to start to die, and then you get blind. So this is one complication, and it has social, it really has very bad social impact. You can imagine on the quality of life. You were driving yourself, or you were using taxis by yourself, you were going to the toilet by yourself, you were doing everything by yourself. You could see, you could choose what you want to wear, you could choose what you want to eat, you could see colors, you could see, you were just a normal person with normal sight. And then all of a sudden now, because of diabetes, you can't see. It can really be quite stressful and has psychological effects on the patient as well. Then we have the heart issues, like I said, that diabetes pretty much affects every organ that we have. It has been proved that people who are diabetic are at a much higher risk of getting heart failure than someone who doesn't have. So heart failure, if you look at this heart and the size of the heart, it really looks quite compact. So with heart failure, the heart gets bigger, and with the heart, we usually think the bigger the better, but with the heart, the bigger the worse it becomes. Once it gets bigger, its function is compromised. So when the heart gets bigger, each function is compromised. It's not going to be able to pump blood the way it was going to be doing. So you can't handle fluid. So you see a person now, he has got heart failure. They have got fluid which pulls in the legs. That's in the legs can go up and, until someone is almost like drowning in their own fluid. So they'll come and tell you, my legs are swelling. Sometimes I think I was sitting for long, and then if I raise them, but now it's not helping. I feel tired easily. I can't walk upstairs, or I can't walk uphill, or I can't walk even on flat ground. I can't walk as fast as I used to be. And you examine them, you actually see that they're in heart failure. So diabetes actually puts you at high risk for heart failure. Your heart will stop functioning, it will start to fail, fluid will start accumulating in your body, and you drown in your own fluid. And that's not good news. The next thing is heart attack. You see, these two are different. Heart attacks can later lead to heart failure, but they're different processes. So with the heart attack, I'm sure you can see here on my heart that I have, and my arrow is going along a blood vessel. So the heart pumps blood, but it also needs blood. So there are these superficial vessels that supply the heart itself with blood. So in diabetes, it has been proved that you are at very high risk of getting clots in these blood vessels. So, say for example, you clot there, all the area where your blood supply was going to reach is now going to be cut off from blood supply. So the muscle there dies, and that's called myocardial ischemia, or what we know as a heart attack. Then a person has a heart attack because there's an area of their heart that is not receiving oxygen because it has been what? It has been blocked. And the severity of this heart attack depends on which vessel has been blocked, how blocked is it. Some vessels block completely cut off. Some are not completely cut off, but the lumen is reduced. So, and some are tiny vessels, so that they just supply a small area. And if that very small area is affected, you're really not going to see any symptoms. So it all depends. Unfortunately, once you have diabetes, you can't choose to say, okay, my diabetes, me, I want the small vessel, I want the bigger vessel. You can't choose. Once this starts happening, then you are not in control anymore. And you can get a what? You can get a heart attack. Okay, the next thing is a stroke. You see, the same concept that I was describing on the heart can also happen in the brain, where blood supply to a certain area of the brain is cut off. So once it's cut off, there is no oxygen, and that area of the brain cannot function without oxygen, you see. And then it dies off. So that's a stroke. Then someone can come saying, my face is going to the side, I can't lift my left arm, or I can't use my whole left side, or when it's really a bad stroke, the whole side is not functional, you can't even talk, you can't, your relatives or the people you stay with, or someone visits you and seeing you unresponsive, and then they call the EMS, and then you're sent to the hospital only to be diagnosed that you have a stroke. And stroke can really be quite, it can be quite stressful. It's so life-changing in a moment. The next minute you were doing things for yourself, the next minute you need help for almost everything. And people can get into depression when they have when they've had strokes. I've seen lots of patients, some who were CEOs of big companies, some who were managers, some who, even those who didn't really hold any positions, but because they could just do stuff for themselves, and all of a sudden they have a stroke. They need assistance to even go to the toilet. They need, they're using, some are at the point of using pampers, some are, you really can't help yourself. And the bad thing about stroke is sometimes your brain function is preserved. So you are alert as to what is happening, but you have no control over what is happening. You want to communicate, but you can't. You want to say something, but maybe the stroke has affected the area that also deals with your speech. You can't express, and then we say the person has expressive aphasia, like you want to say something, but you can't. And there's a point where sometimes you can hear that I'm talking to you, but you can't really make out what I'm telling you. Oh, and then the most common sequel is that you can't function. The affected side can't function, so you can't walk. You now need to go to the physio. You need to start learning to walk again. and then that means already you're out of a job. If you were the breadwinner, then it means the family is now suffering. So I really want you to understand that the complications of diabetes have an impact not only on the person who is sick, but also the people that surround you. It impacts everyone. So it's a matter of the infected and the affected. Like we say when you're talking about HIV, we have infected and affected. So diabetes, it's you, the person who is sick, and everyone else who is around you. When complications happen, they affect everyone. Okay, the next thing is liver failure that I want to talk about. This is one known complication of diabetes. So diabetes is quite linked to irregularity in fat metabolism. So most people who are diabetic are going to be having cholesterol issues. So once someone has, I want to look at, let me get to this picture. This is a healthy liver. You see how nice and clean that is. And then fat starts accumulating in the liver. And we get here where it's written steatosis, fat accumulation. While we are still here on fat accumulation, it's still reversible. You can reverse back to the healthy liver if you change your lifestyle, like the way we are going to speak about later. From this steatosis, which is fat accumulation, they can then be inflammation. And so this is steatosis and inflammation, and it's now known as NASH. NASH means non-alcoholic, sorry, let me go back. NASH means non-alcoholic steatohepatitis. So it means that, in a way, like putting it very loosely, you are having changes that we expect to occur in someone who takes alcohol, but you don't. So it's called non-alcoholic steatohepatitis. Because of it comes in as a complication of diabetes, that your fat accumulates in the liver, and after it's accumulated, then there is inflammation, and then your liver function is really quite disturbed. Then after this whole time of inflammation, the liver becomes fibrotic. So you have fibrosis happening, and then the liver gets ugly and starts scarring like that. And then from there, the liver can go into, can change and start having cancer. So you can have hepatocellular carcinoma from a liver, which is like this. So once a liver gets to cirrhosis, it comes with a lot of other complications like portal hypertension. And portal hypertension can give you ascites, which is fluid that accumulates in the tummy. It can give you bleeding. There are patients who actually present with vomiting blood. You bleed in the esophagus. There is esophageal varices. There is gastric varices which can bleed, which have come as a complication of cirrhosis. And because there's increased pressure in the portal hypertension, it's like it has waves that go backwards through the whole circulation system. Your spleen can get bigger, and because your spleen is bigger, it's going to clear your platelets. The platelets are the small, tiny cells in your blood that help you to clot. So you see this whole, stage by stage things getting worse. So diabetes is really a condition that we need to sit up, tighten our belts, and think about at a personal level. This must stop being a condition that doctors deal with or nurses deal with. This must come to a condition that you are conscious about and you want to do something about it, because all these effects, when they start happening, there's little the doctor can do for you now. There is a lot that you can do for yourself before we get to here. Okay. The next complication, which is very common, is kidney failure. So, like I said, every organ is going to have its share from diabetes. Your kidneys, the small vessels that also supply your kidneys with blood, are going to be injured, and the kidney is going to be persistently exposed to very high levels of sugar than it can handle, and your kidney will fail. The kidney has a duty to clear some dirt from your system. So there is what we call urea, there is what we call creatinine. Those two types of dirt, they are cleared by your liver. Then your liver is also, sorry, not your liver, your kidney. It's also there to balance some electrolytes like potassium, like sodium, like calcium, like phosphate. They are all balanced by the kidney. So once your kidney fails, all these functions are also going to fail. Your kidney is also important for blood levels. It produces this hormone called erythropoietin, which is going to help in building up blood. So once your kidney fails, also that pathway is also going to fail. And diabetes is a leading cause of kidney failure that requires dialysis. And let me tell you, dialysis is not easy. It's not easy for you to just wake up and say, oh, my kidneys are dead, so why? I just connect myself to the machine. First, it's a machine. It was not meant to be. So the way it functions is not exactly, even if it approximates, but the way it functions is not going to be the same as your kidney. Okay. Second, it's time consuming. Mm-hmm. If you are on hemodialysis, you're going to sit on that machine for about 4 to 6 hours per session, 3 times a week. That's time lost. And this is time that you're just sitting on the machine. We haven't counted the time that you wake up at home, prepare to go to hospital, get on the taxi or drive to hospital, go there, wait for your turn to come, get dialyzed, can finish about 4 to 6 hours, get disconnected from the machine, prepare for transport to go back home and going back home. So it's like your whole day is gone for dialysis. And the next day, you are like, okay, I'm resting. But the next day, you have to go back again for dialysis because you see patients get dialysis sometimes Monday, Wednesday, Friday. That's basically the whole weekend, the whole time, and you get tired. And it's just a draining procedure on you as a person, and it's also quite expensive. It's very expensive. And you realize that the government, especially here in South Africa, the slots are very few. They can't handle even the patients that need to be dialyzed. They try to employ different criteria of managing who gets on the dialysis machine. It's a first come, first served basis. You have to have all your other organs normal. And when you have diabetes, they need you to get checked that your heart is normal. Remember, we talked about the diabetes and the heart. And most of the time, when diabetes is already causing problems with your kidneys, it has already dealt with your eyes, and there might be complications with your heart as well. And you need to go through tests to prove that all the other organs are normal first. You have to prove that the only organ that has a problem in your body is the kidneys, and then they'll put you on dialysis. But that's very rare. In someone with diabetes, it's very rare for you to just come only with kidney failure and nothing else. Already when kidney failure is there's other things that are happening as well. In private, they'll dialyze you, but it's quite expensive. There's the surgery that you need to put in, the catheters that are used for the dialysis. It costs money. It costs you pay the physicians, you pay for the time, you pay the hospital. It's just going to eat out of your pocket. So diabetes is really quite an expensive disease, and once it hits your kidneys, you are like going down on a one way. It's going to be very difficult to reverse you. So, like I sometimes tell my patients that you have one foot in the grave and another on a banana peel. So, if there's a time that you need to wake up, it is now. Wake up now before complications start happening. Okay. The other sad thing that comes from diabetes is amputations. Remember, I was talking about the blood vessels. We are still talking about the blood vessels that get damaged because of diabetes, and there's no blood supply. If this one is just a photo of someone who has been amputated, they have all their toes cut off. They can cut off at the toes, they can cut off at the ankle, they can cut off below the knee, they can cut off above the knee, they can remove the whole leg, depending on how far the disease has gone. And believe you me, amputations happen quite frequently, quite frequently. And this is another sad thing, that you were walking by your 2 feet, you were mobilizing by yourself, probably you were a sports person, you were running around doing your errands, and then all of a sudden you have to take your leg off. It's quite disturbing. I've seen a lot of patients that can't take the news lightly,
Mm.
that your leg now has to be cut off because of diabetes. Okay, so let me just quickly run through.
And
Mm-hmm.
I was looking at the amputation, and then I remembered how often, because of the high blood sugars, the wounds don't heal well often, and you are
That
at high risk for infection. And often they start with a part of the foot, and they get gangrene, and it eventually goes up in a few years. So it's not an amputation that's going to be the end of it.
Yeah, it's
Just
not a risky thing. And actually, that's the other complication of diabetes. Wound healing is very poor, and you also develop abscesses very easily. So someone can just come with, I have boils, I have a boil under this arm, I have a boil under here, I have another boil at the back. If you come to me with such boils, or I had a boil last month, I have another boil now, I also had another boil last week. If I hear that story, I want to make sure you don't have diabetes, because part of the complications includes wounds that do not heal and loss of boils just erupting everywhere. So I'm just going to do another quick rundown of the complications of diabetes. I need to make sure I scare you enough. Okay, so blindness is one that we spoke about. Heart attacks, heart failure, you are at very high risk, more than the general population, to get a heart attack if you're diabetic, or to get heart failure if you're diabetic. Strokes also happen more commonly in diabetic patients than the general population. Liver failure, which has stages, first from steatosis, which is just fat accumulation, to non-alcoholic steatohepatitis, to cirrhosis, and which can proceed to other complications that are related with cirrhosis, including vomiting blood, including ascites, which is accumulation of fluid in your tummy, splenomegaly, clearing of your platelets, and finally your liver failing to do its function, and you get liver failure. And once you get to the stage of liver failure, the only way is transplant, and we know that transplants don't come that easily. Okay, then kidney failure, I spoke a lot about it. Amputations, and then the issue of wounds not healing, and the boils that you can just continue having. So these are the complications of diabetes. And let me be quick to say, this is by no means exhaustive. There is lots of other issues that happen with diabetes. Okay, so the risk factors for diabetes, how do we, we're talking about type 2 here. Like I said initially, that it is quite related to lifestyle or the environment a lot. So what are the risk factors? I'm sure you're liking my pictures here. Your weight and waistline. I need to emphasize this. Your waistline tells a story. So this is how you measure your waistline. You stand on a flat surface, barefooted, if possible. Just stand there. Do not breathe in, and measure your waistline across your umbilicus, okay, or the belly button. Just measure, relax. Do not suck your belly in, and measure around. I am really encouraging you to do this. This is something that's quite inexpensive, okay? So for men, your waistline must be below 94 centimeters. If it gets to 102 centimeters, it's a sign of danger. You need to get some screening. For women, it mustn't be above 80 centimeters. And if it gets to 88 centimeters, that's a sign of danger. There is an adjustment that I forgot to put here for Asian. Asian, if you are Asian, just you can check for your ethnic group, because I think Asian men have got a lower. I think Asian men are at 90 centimeters. They have a lower maximum they have a lower maximum centimeters that they are allowed to have by virtue of their ethnicity, and most of them are not as tall as the rest of the other people. So that putting that in together, they have a different reference range. Okay, but generally for most of the people, 94 centimeters for men, that's the maximum you can get to. If you see it getting up to 102, that's danger, very dangerous. You need to go and get checked. And for women, that's 80 centimeters, 88. 88 is now like danger sign. Just get a quick check. Check your waistline. It's quite important. Your waistline is highly associated with disease, especially non-communicable diseases, and diabetes being one of them. So once you see your weight starting to get off, especially your waistline getting off, then you know you are like on your path to get diabetes. You need to do something about it. Okay, the next thing is the sedentary lifestyle. We love sitting. We sit all the time. We sit in the house, we sit in the car, we sit in the office, we sit at the restaurant, we sit at the coffee bar, we just love sitting. And sitting and diabetes are good friends. They are quite good friends. This sedentary lifestyle that we are used to, I mean, just look at it. You wake up, you sit at the table for breakfast. If you actually have breakfast, you walk out to your car, you get into your car and you sit and you drive, you get to work, you get into the lift, you press your level, you get into the office and you sit the whole day. Mm-hmm. That's not healthy at all. We have adopted this sedentary lifestyle. There's no activity, you know. Some people, I've seen some companies which have had to change workstations. Each person has a workstation which can allow them to work while seated or to work while standing. So they can always alternate. They are sitting for some minutes and they're standing for some minutes. That will actually be quite helpful. We need to, to get active, be active, avoid the lift whenever you can, avoid the lift. People get into the lift to go from the ground floor to the first floor, which is like just one flight of stairs upwards. I understand someone who gets in the lift to get to the 13th floor or the 15th floor, but from ground zero to the first floor, I mean, just ignore the lift, get up, walk up the stairs and down. Try to be as active as you can. Try not to drive and park right at the door. You want to get into a mall, you want to park closest to the entrance. Just do those things to try and help yourself to walk around. Just park as far as you can. Those steps that you walk, they are worth it. Okay, so the sedentary lifestyle, where most of what we do is sit and eat, that one is the friend with diabetes. You're just going to put a poster that diabetes is invited here, and it will surely come. It usually listens to invites. Okay, then what you eat, it puts you at high risk for diabetes. You see, refined food. People do not like eating fresh food. They always want it boxed, bottled. It's in a tin somewhere, it's in a plastic somewhere with a list of ingredients and percentage daily requirement. And I mean, this food that we love to eat, it's more like dead food. There's no fresh food. It's all packaged, it's all well preserved, and it's well seasoned, if I can say. They put lots of flavor enhancers there. They put a preservative so that it stays as long as is possible. It's quite refined. They've taken out all the nutrition that's there. And once they've taken it out, then they put on the label with added vitamins, added B vitamins. Why are you adding the B vitamins? The ones that were there initially, where did they go to? So, and you see that our society, we eat refined food a lot. We do not even sit to think, what exactly have I eaten? Refined food makes, it makes our life. That's what we eat. And it's quite convenient, by the way. Very convenient to just open a bag, pour in your bowl, put in the microwave, take it out, eat. Very convenient for us, time-wise, but it's not convenient for our bodies. It's just going to be calling out on that fat to accumulate on your waistline, and then it causes the diabetes to come. And once diabetes comes, it's going to cause a lot of damage, like I have just shown you. Foods that are high in saturated fats, our energy, less than 10% of our energy must come from fat, not more than 10%. But you see that people eat lots of this saturated fat. Most of the energy actually comes from saturated fats. They eat the cold meats, the cheeses, and if you look at some people's breakfasts, sometimes I pass by restaurants and I look at the menus and I'll be like, people are serious. People want to, they are food lovers. They want food to kill them, really. You see, it's a breakfast plate. It has got different types of cold meats, plus a fried egg, plus some white toast with butter on it. You know, it's just it's not food to feed our body cells. We need to eat fresh food. We need to make sure the food we are eating is not very high in fat. Less than 10% is part of, is our energy, must come from fat. And if you choose more plant fats than animal fats, that's better. Okay, so let me pause here and just talk a bit about the treatments that we offer in the hospital for diabetes. So, like I said, for type 2 diabetes, you are going to get, there's a different classes of drugs, tablets that you are going to take. And let me be quick to say that tablets are going to help to control your blood sugars. When you check the numbers are going to be good. But that does not mean that you are not going to get diabetic complications. So a person who is taking their oral drugs, they are very compliant. They take it all the time. They don't miss doses. They are controlling their sugars quite well, will still get diabetic complications. What the tablets do is they just slow down the rate of you getting complications, but you are still going to get there. So I hear patients will be like, but doctor, why? For the past 6 years, I have never missed a dose. I've been taking my tablets as they were prescribed. I've been doing everything. So why now am I getting complications? So my answer to them is, you know what? Tablets are not meant to cure diabetes. They are going to slow down the process, but we do not stop it. So you're going to take your tablets as prescribed, depending on whether you're in private or government. Some tablet options are not available in government. They are only available in private. Depending on your doctor, they will see if you are overweight or obese. They might choose metformin over the other drugs because it's the one that will also help you with some weight loss. And then you keep getting monitored. That HbA1c that I talked about is also one monitoring tool that we use to see. We have target percentages depending on your age and level of activity. In very elderly people, we're not going to aim for tight control because they are very prone to getting hypoglycemias, which is very, very low sugar. So we don't want to keep their sugars quite tightly controlled. We keep them a bit loose because they are easily tipped to the other side. So if you're like 60, 70-year-old, 75, 80-year-old, I'm really not going to get worried if your HbA1c is like 7.5%, 7 to 7.5%, I'm not going to get worried. But if you're a 38-year-old person who is quite active, you still have got life ahead of you, and you come to me with an HbA1c of 8%, I'm going to get worried. I need your sugar more tighter, more tightly controlled. So your doctor will also use the HbA1c to monitor the percentages and see. The other tool, which is quite important, is for you to get a diabetic diary. So before meals, you can just check what your sugar is. 2 hours after a meal, you also check what your sugar is. So initially, you can be checking after every meal, before every meal, after every meal. At least it will help the doctor to come to a dose of what dosage to give you of whatever treatment they're giving you. But afterwards, once you have settled into your own, like your own regimen that's comfortable with you, you really don't have to be checking after every meal. You at least once a day you get a recording, and then throughout we can see or how your sugars are doing, and we can try to control them better from there. But remember what I said, taking tablets judiciously does not mean that you are not going to get complications. You are still going to get them, but albeit at a slower rate. Okay, so besides that, after your tablets, you can get insulin. Like I said initially when we were beginning, that it starts off as an insulin resistance disease, but then you also get to insulin deficiency. So you come to this point where maybe your HbA1c is persistently around 15%, 14%. We really see that no, these tablets are not going to get us anywhere. We need to introduce insulin. This patient also now lacks insulin, and you start getting your insulin dose. It could be just one dose. Maybe you get a type of insulin called protophane. You just inject once. And sometimes if you need a bigger dose of the protophane, you might end up injecting twice in a day. Or we might use a type of insulin called actrafane, which you also inject twice before breakfast and before supper, 30 minutes before your breakfast, 30 minutes before your supper. You have to inject yourself. You need to be quite careful to eat after injecting, because once you inject and you don't eat, you're going to push yourself into hypoglycemia, which is a very low sugar, because the insulin is just going to do its job. It's going to clear sugar out of your system. And if you have not eaten, then your sugars are going to be quite low. So you need to be careful. If you're on insulin, make sure to eat after every what? After every dose of insulin. And you need to be more judicious in checking your sugars. I think if you're a government patient, if you're on insulin, you always get a glucometer. If you don't have, if they have not given you or the pharmacies have run out, you do yourself good if you buy your own glucometer. It's for your own health. You buy that and you monitor and you check your sugars for yourself and see how they are doing. It pays to be compliant, like I said, be compliant, listen, adjust, take charge of your health, because you don't want these complications happening as soon as possible. You want to delay them for longer. So you need to understand that and understand that it's within your power. Okay. So now I'm going to talk to the people who are already diabetic or who are having impaired glucose tolerance or who don't know yet where they stand, who want to prevent or who want to reverse their diabetes. The first thing is get checked. Know where you stand. Just this finger prick glucose can give us, some idea of what's happening. It might not be feasible for us to say, everyone go to your doctor, get an HbA1c done, but a finger prick is something that's very close to you. Just get checked. Don't say, I don't feel like I have diabetes, because you might not feel anything. And even for those people who are already diabetic, especially those who are diabetic for a long time, they tell you, I feel it when my sugar is up. I feel it when my sugar is low. I do understand, especially when the sugar is very low. You can feel that you get dizzy, you want to collapse because your sugar is quite low. You feel like just lying down, you have no strength and whatsoever. And sometimes you're sweating. That can happen, but you might not feel anything if your sugar is high. And when it is high, it's going to cause problems. When it is too low, it also causes problems. But when it's high, it's also going to cause problems. So be objective and stop being subjective. Just get checked. Let's see where you stand. Just walk into a pharmacy or the doctor's rooms, or get your own machine. Just check and let's see. If you just do a random prick and the reading comes back as like 30 millimoles per liter, then I'll be like, this is very high. You don't have symptoms. Let's see what's happening. I think you're diabetic or you have impaired glucose tolerance. So let's see which is which. And then I can do the HbA1 test. I can do the oral glucose tolerance test if you are not having symptoms. I can do the fasting plasma glucose. And then I can give you a proper diagnosis if you're diabetic or not. But the important thing, just get checked. Just a fingerprint, a finger prick, it's enough, at least as a screening method. The next thing is walk away. Just walk away from diabetes, right? Remember, we said that sitting, so the sedentary lifestyle, sitting and diabetes are good friends. You need to exercise, walk, be active, you know, find time to be well, because if you are too busy to prevent yourself from getting these diseases, you have all of the time in this world in your grave. When in your grave you have 24 hours to yourself in the grave, no one will disturb you. So you need to find time now to get well, because the 24 hours a day, 7 days a week in the grave are not nice hours. You need to spend them now. So make time to be well. I mean, there's nothing the doctor can do for you if you're telling me that you don't have time for your own health. I mean, if you can't have time for yourself, what can I do? I'm limited. So find time, see what you can glean, you know. Take a few minutes off social media, take a few minutes off the TV, take a few minutes off this chit chatting, you know, and walk. Just walk. Walking is enough. Walk at least 30 minutes a day for more than 4 times a week. Then, you know, you keeping yourself active. If you can do the weight bearing exercises, that's even much better. So I encourage people, we have smartphones. The smartphones usually come with apps, or it already has an app that you can use to work out how many steps you have done. Aim to make sure before you sleep, you've done about 10,000 steps before you sleep every day. Some people get the pedometers that actually count, that they put on their shoes or on their ankles. That's good. Some have smartwatches, some have smartphones, whatever it is that you can use that. Make sure. I want to challenge you. You know what? I see people who tell me, I walk a lot at my workplace. Must I still exercise? I've given them this challenge. Okay, go and walk a lot at your workplace like you usually do. At the end of the day, tell me how many steps you have done. And I'm like, doctor, I think today I didn't walk that much. I have 2,000 steps, but I know tomorrow I'll be walking a lot. The steps never get to 10,000. So that tells you the walking a lot that you do at work, you feel like you've done a lot, but like I say, let's be objective and not be subjective. Let's count. Let's see how many steps you're doing. Don't just think, with the way I walk, I've walked already. That's enough. Go a step forward. Count your steps. Let's see. After work, give yourself 30 minutes. Walk around in your neighborhood. Walk on the treadmill. Get to the gym. Do some work. You need to exercise. Exercise benefits for both prevention and reversal of diabetes. If you have type 2 diabetes, it prevents you from proceeding to needing insulin. If you have type 2 diabetic who is on oral tablets, not yet on insulin, if you exercise enough, it prevents you from progressing to needing insulin, and it can actually make the doctor to drop off your doses, because exercise is one single thing that's quite important on regulating blood sugars. I don't know how I can overemphasize this. You can reverse your diabetes if you walk and exercise enough. But mind you, let me be quick to say, even though it's one of the most important things, it doesn't stand alone. You need to take this whole thing as a holistic approach. But I want to emphasize that activity is needed for regulation of blood sugar. So if you are pre-diabetic, or if you have impaired glucose tolerance, you walk, you exercise, you get active, you might actually prevent progression to what? Progression to having full diabetes. Or if you're already having diabetes, you prevent yourself from getting one drug on top of the other on top of the other until you've had insulin added to you. I've seen patients who have actually ended up dropping the insulin, remaining only on the orals, and even the orals, the dose is getting reduced, because people have now taken their boots and they're now starting to walk. I want to talk to some men I've seen from our societies, especially people from my church. They have activities on a Sunday. They usually meet and play soccer on a Sunday. And they tell me, all the exercise I need, I'm going to do on Sunday. That's a lie. It doesn't work that way. You do not exercise for tomorrow. You only exercise for today. Unfortunately, you cannot store exercise. Each day needs its own exercise. So you can't sit throughout the whole week and say, you know what, I'm going to run 90 minutes. I'll be running on Sunday. I mean, that's enough. That's enough exercise for the whole week. No, it doesn't work that way. You will need to exercise, like I said. The more you do it, the better, but at least for 30 minutes for more than 4 times a week. So, which means most days of the week, you exercise on a daily basis and at least 30 minutes. So, you need to just get active on a daily basis. Okay, I cannot overemphasize how exercise is quite important, both in preventing progression to diabetes or progression of diabetes, also in reversing whatever stage that you are at with your diabetes. Okay, plant-based foods. Diabetic patients, even just a normal person, we have always heard about the 5 portions of fruits and veggies every day. Plant-based foods, they come with fiber. They are very low in fat. Remember, we said less than 10% of our energy must come from what? From fats. Like fats must not contribute more than 10% of the energy we need. Plant foods come very low in fat. They come with lots of minerals and nutrients that we are going to use. They come with lots of fiber, which is a very important nutrient. Fiber, I know we do not absorb it, we do not digest it, but the function that it has in our bodies is quite important. It regulates sugars, it regulates how quick a food releases sugar into our bodies as well. So we need fiber. And there is no animal product that's going to give you fiber. Fiber comes from plants, not from animals. So as long as you're eating animal products only, you're not going to get fiber. And sometimes people take the plant foods and they process them. So I do advocate for a whole foods plant-based diet. I do not use the term just vegetarian or vegan, because there is a number of vegan food or vegetarian food which are really not healthy. I mean, like I said last time, if you saw our last clip, you can live on Coke and chips, French fries and Coke. That's very vegan, right? Or very vegetarian. But is it healthy for you? No. If you're going to live on sodas, and I just use Coke as an example, if you're going to take all these different types of sodas and French fries and, quite refined food, of course you might say, hey, I'm a vegetarian, or hey, I'm vegan, I don't eat any animal product. But the choice of plant products is not the best. So I really encourage us guys, let's eat as much plants as we can. Let's eat as much color as you can. You see how my screen is so colorful. As much color as we can, let's throw in the colors. Eat the purples, eat the red, the green, the deeper green, the red, the yellow, the white. Just put them all together and eat a rainbow. That's going to give you a variety of nutrients together and enough fiber, and that's going to help you control your sugars, and that's also going to help you reverse whatever effects that you might be going through. Okay. Then we have the grains and legumes. These ones are so important for our diet. They give us the healthy starch. I know most people, when they speak about weight loss, their issue is, I want to lose weight. I am not eating starch at all. I do not touch starch. So I want to correct that and say, you must stop taking refined starch. It's the refined starch that's a problem. The refined white flour products that we eat, the refined meal products that we use, any starch that has had its fiber taken off, that's unhealthy starch for you. Weight loss can be manageable even with starch, but with unrefined starch. Your body needs the starch. it's a nutrient that you need, it's a nutrient that you can process. But when we take the starch and we make it go through lots of processes before it gets onto the table, then that starch is now not the best source for us to take. And you can still lose weight. I know most people who have seen me before, those who know me, who might be watching, have seen how I have lost weight myself. At some point, I was 96 kilos, and now I've lost more than 20 kilos, and I've kept them off over the past 9 months. And I never stopped eating starch. I still eat my starch, but you need to be careful as to the type of starch that you're eating. These white flour products, the pizza bases that are made from white flour, the bread from white flour, the pap we eat from that very white mealy meal, the white rice we eat, where everything has been stripped off, all the nutrients have been stripped off. Now we remain with this empty, starchy component. I don't know what to call it. If that's all we are going to eat, that's a bad starch, and that's not going to be good for us, and that's going to make you put on fat, and not just put on fat in the dangerous area, your waistline. So we need to be very careful as to the type of starch we take. If we're going to eat a variety of the grains in their unrefined form, they are quite filling. You eat a small, when you're eating the proper type of starch with all the fiber, you don't even need to worry much about portions. First, they are very filling, there's lots of fiber. Second, there's lots of chewing. You get tired. You chew and you'll be like, this is enough. There is lots of chewing. It's not this refined food that you can, how many people really chew the white rice? You can throw it in and swallow, and that's it. So this type of starch, which is unrefined, it's self-limiting in itself. First, it's quite filling, and also you're going to chew a lot, and the chewing is actually going to start the digestive process already in your mouth, and you're going to release enough gastric juices at the right quantities to digest your food. So if you get any take-home message today, if you are living with diabetes or want to prevent diabetes or want to reverse diabetes, do not eat refined starch. Stick to the grains as wholesome as they are. Eat a variety of your legumes. Eat your fruits and veggies. Put that together and you have a good balanced diet. Okay. Water, I love drinking water, but I have people around me that I need to push to drink water. I'm like, water doesn't have a taste. I'm like, really? What taste were you expecting it to have? It's water. It's not supposed to have a taste. And my kids know that when I'm drinking water, I don't want to be disturbed. So they're like, Mommy, you want water? They give me the water and they step back, because I really enjoy taking water. Just plain water is it's one of my favorite. And not the sparkling water, just the still water. I don't want any carbon dioxide added to my water. So take the plain water, and this is what I always say, that water is liquid gold. Is the real deal, not any of these beverages. It's actually the drink that does the job, because you need to quench your thirst, you need to clean. You quench your thirst with water, you clean with water. You never clean with any sugary carbonated drink. You always clean with water. So water actually does the job. It's the gold that comes in liquid form. So we must value drinking water. I also speak of infused waters. For those people who really can't take water, they want to start taking water now, you can infuse your water. Just throw in a tiny slice of lemon in your bottle, close it up, shake, give it some time, and you drink. It comes with this lemony flavor. Throw a few leaves of mint in there, or lemongrass in there, or a few slices of cucumber or orange or grapefruit. Just put whatever in there and you take it as infused water. That way you can encourage yourself to take more water until when you can drink plain water without a problem. And water comes in with 0 calories. It's just like 0 calories. Okay, For those people who have already had a complication of diabetes, like they've already had kidney failure or heart failure, you need to be careful about how much water you're drinking, because already your body cannot handle the fluid. So listen to what the doctor guides you. If the doctor tells you 500 mils of fluid, listen and continue. And if you need to increase, if your urine output increases and all that, and the doctors are seeing, they will be telling you, okay, now you can drink a liter, or now you can drink 750 mils. Don't just go and push water down, because already your body has been compromised. You need to take it slowly, and you need to be monitored while you're doing that. With the rest of us, guys, let's drink enough water. And this is how you can check to see whether you're drinking enough water. You need to test is really a late sign. You know, you don't need to, you mustn't wait until when you feel thirsty for you to drink, but you can rely on your thirst and drink each time you're thirsty. If you can drink before you even get to being thirsty, that's fine. The second thing is, when you go to pee, just look at your urine. If it's going to be like a deep yellow, almost turning green color, like a very dark color, then it means you're drinking less water. You need to drink more. And the smell of that urine mustn't be this very bad smell. Urine has got its own smell, but it mustn't be this very heavy, pungent smell that it has. You must drink more water if you see your urine is like that. And now also for your number two, when you go to the toilet, you mustn't pass hard stool that's like pellet-like, that's very difficult to pass. Your eyes are almost popping out when you are passing number two. No, that mustn't happen. Stool must be, sorry, I'm gonna use a food item. It must be like a sausage. It must be continuous, no cracks, just smooth, and you pass through like that. If it's anything like breaks and pieces, or it's like pellet-like, that means that you need to drink more water. And like I said, people like, I drink a lot of water. If I ask them, what is a lot? They tell me, drink like the whole day. I drink a whole 500 ml bottle. Then I'm like, okay, 500 mils. So again, let's be objective and not be subjective we are taking. We know for an average 70 kilo man, you need to take, it depends, but if you start with like 2 liters for the whole day, if I'm telling you 2 liters, I'm not saying take a 2 liter bottle, fill it with water, sit down and drink it down all at once. No, no, no. I'm saying over the whole day, you spread that water across, depending on your activity and probably the type of food you've eaten. If you've eaten so much spicy food or salty food, you probably drink more water. And we don't encourage those foods which are too spicy or too salty anyways. But also depending on your activity, if you're going to run, and the weather as well, it's water these days, it's going to require you to drink more water. But just to start with, just a 2 liter bottle, take it over a day. See if you can take more, see how your urine is, see how your stool is coming out like, how much you're sweating, and then just adjust as you go along. But remember, water is like liquid gold. Okay, here on the temperance, this temperance slide that I have, temperance means self-control. If you want to win the war over diabetes, you need to know when to say no and when to say yes. I wish I had 3 arms, then I would put to say enough. So know when to say no, know when to say yes, know when to say enough. Okay? You need to have a strong willpower. You can't tell him, I couldn't resist because it was her birthday, and then there was this cake, and then there was this leftover cake, and then there were these muffins, and then there was this pizza, and then you need to learn to say no. You need to learn to say yes. You need to learn to say, okay, I said yes, but this is enough. Okay. So we need to come to this balance of knowing when to say no, when to say yes, when to say enough. It's quite important if you're on a journey to fight diabetes. Okay, exposure to the sun. The sun does a lot to our bodies, the more than we can understand. So I encourage people to expose yourself in a healthy way to the sun. I'm not saying like now it's summer and it's 35 degrees, go and sit in the sun. No. Sunrise, sunset, the sun is, weak enough to not cause problems, but strong enough to give us benefits. If it's in winter, it's a different story. The afternoon in a winter can actually be quite comfortable, and you need to expose your skin to the sun, and then absorb enough vitamin, convert the sun's energy to enough vitamin D, and you get all the benefits that you can get from the sun. You all know that the sun provides a different kind of heat, and we get different benefits from it than we get from your heater, your stove, the heat from your stove or your heater. The UV lights that come from the sun are actually quite beneficial. So expose yourself in a healthy way to the sun. Okay. Then fresh air, be outdoors as much as you can. Fresh air is going to do a lot to regularize your system, for you to fight inflammation, for you to fight, diabetes is also actually a condition of chronic inflammation. So for you to fight it, you need to be exposed to as much fresh air as possible. Work outdoors if you can. Make sure your environment is kept clean. Plant as many trees around you as you can. Get exposed to fresh air daily. In your rooms, open your windows wide, pull over the curtains, those heavy curtains. They are nice, yes, they give a nice decoration, but you need fresh air to circulate. We need rest. Rest is really going to help our systems to reset. Of course, we need to be active, but we also need to rest. We also need to sleep. Get enough time to rest, enough time to sleep. We know we have got lots of work to do. Let's try to do our work on time and leave enough time for us to sleep and rest well. That can help us in overcoming any form of disease, diabetes included, but any form of disease, fatigue, the high blood pressures, even in a cancer patient or in any diagnosis that you have. Rest is invaluable. You need to get to a point where you rest. Okay, we trust in God, that God can restore. Our religion comes into play here. We do understand that God is the creator. We believe that God created us, and we believe that only Him can restore. He can restore anything that has gone wrong in our bodies. He has the ability to do so. We can trust Him to restore us back to good health. I can say, Connie, I don't know whether to call this a summary or the whole length of it. This is what I can offer today for people who are living with diabetes, or who are pre-diabetic or have impaired glucose tolerance, or those who are already diabetic and want to reverse. Maybe let me just quickly go through the steps again for those people who want to really fight the war against diabetes. If you don't know whether you're diabetic or not, my recommendation, the first one is get checked. Second one, exercise. You need to be as active as possible, at least 10,000 steps a day. Eat mostly of plants. They come without any ingredient packaging. There is no sodium benzoate or metabisulfate. There is no big names or E621 or E whatever that comes on the label. They come without labels. They are as natural and as good as they can get. Eat of the unrefined starch, your grains and legumes, eat a mixture of those, and you help yourself with winning over diabetes. Drink water. That's the only beverage that's safe for you. Water is liquid gold. Know when to say no, know when to say yes, know when to say enough. Expose yourself to sunlight in a healthy way. Get fresh air. You need to get rest. Trust in God. And with all these, you are armed. You are fully armed to fight diabetes, to prevent it, to reverse it. If you need help, you can contact us. We can work with you step by step as you work towards reversing your diabetes or preventing diabetes. We can give you more personalized advice and more personalized programs. This is a general talk. I hope someone has seen from how diabetes is diagnosed, to its complications, to the risk factors, to what you can do to overcome it. I'll hand over back to you, Connie.
Thank you so much, Dr. Matanda. That was so informative, so educational. And it just makes me realize that we actually have to take responsibility for our own health. We can't hand it over to anybody else. And what's more heartwarming for me that is that as Seventh-day Adventist Christians, we have a health message that we often don't obey or follow. And I trust that we will do introspection and do what God has commanded us to do. And just, we will reap the benefits by preventing non communicable diseases. You have seen the dangers of non communicable diseases, and we need to live a happy, healthy life. Thank you, Dr. Matanda. Can we just close our eyes for a word of prayer? Dear Father, thank you so much for all the information we received. Thank you, Lord, that you want us to be healthy and happy, and you have given us a health message. You have showed us in the Bible what it is that you want us to eat. Help us to be obedient to that. Help us also, Father, as intelligent human beings, to take responsibility for our health, to realize that we have one body that you have given us. And so often in the busyness of life, we forget that we need to take care of our health. We worry about everything else and not about this temple that you have given us to look after, Father. So thank you for the information and help us to preserve our health so that we can serve you with body, mind, soul, and spirit. Please, Father God, thank you that Dr. Matanda was willing to take off time to share with us, and please bless her also in the ministry. This is my prayer in your loving name. Amen.